Dr. Rick Seguil.
And action. Hey, Jane, how this is Kirk again.
And action. Hey everyone, it's Dr. Rick. And Micheline had not really a question, more of a statement, and it made me look up a couple things. But so we're going to do an informational video on cytokine storm, because there's been some social media saying that anti-inflammatories and aspirin can induce or worsen cytokine storm, and we'll talk about that in a second. I might get into a little bit, I try not to get into pathophysiology too much, and but we'll see. Anyway, if this is the first time you're finding me, don't forget to hit the subscribe button down below, and if you like the video, thumbs up. And also, don't eat all your supplies. I bought a lot of protein bars and Pellegrino and water, and I was like, hey, I got a lot, I'll just go eat this instead of eating dinner. And I thought, wait a minute, that's all my supplies. It's supposed to last a couple weeks. So anyway, Micheline, very informative and very well read. However, I don't know if you can see this, but so this is an alveolus. This is essentially the lung bleb where oxygen is transferred over, right? And this is up here. That's in direct communication with the air that you have. When you take a deep breath, you bring it through the bronchus into the bronchioles and into these lung sacs, alveoli. And that's a lung sac, all right? And around every lung sac is a blood vessel. That's a blood vessel. So lung sac in the lung, blood vessel surrounding the lung sac. And in the blood vessel, you have these things: red blood cells, macrophages, lymphocytes, and granulocytes. Those are all the protective things that float around in the bloodstream to fight infection or heal up wounds. And in the alveolus, you also have a plethora of different things that help to fight infection. And here you also do have the possibility of a virus, because when you take a deep breath and you inhale a virus from droplet spread, it ends up in the sac. So I believe in my last video I talked about the ACE2 receptor that's in the lung sac that is on a pneumocyte. So this is what happens. The virus gets into the sac. The virus causes a signal to these guys, these patrolmen in the blood vessel. Then when the patrolmen see that there's a signal, they get called out. They come out of the blood vessel and they migrate into the sac, the air sac. So you've got dendritic cells, granulocytes, lymphocytes, monocytes, all migrating out of the bloodstream, out of the highway into the neighborhood to attack what's in the lung sac, the virus. And when they attack, and they all have their little properties of how they attack, B cells, T cells, all that stuff. That's too much to talk about, but just think of it as your immune response. Well, when they start to attack, they also want to call in the reinforcements. So when they start to attack, some of them go outside, specifically I think there's a macrophage. It goes outside because macrophage is responsible for calling the alarm. And it sends these things called cytokines. Those are these little properties, and these are dendritic cells too. The cytokines go into the blood vessel, and the blood vessel sends the blood all around the body, and it says, we have a problem in the lungs. And it calls more guys in to attack and migrate into the alveolus and continue to attack. So you can see how it can it's supposed to stop. So after a while, those are shut down, and after the infection is taken care of, stop. No more macrophage signaling, no calling out, and eventually the migration stops. That would be a properly working system. But in cytokine, so I've got a couple of things. In cytokine storm, the question was whether Advil, ibuprofen, Motrin, naproxen, Aleve, aspirin, the whole family of NSAIDs. I have a video on NSAIDs I'll put down below. I did it in the summertime, and I have bike equipment. Look kind of goofy with my helmet, but if you want to learn about NSAIDs, click on the video. However, I've put together a couple of studies that I looked up just to refresh my memory about cytokine storm. And so there is obviously some information that is out there on the relationship between coronavirus and cytokine storm. But I guess I'm going to try to present that if you look at it, it's probably not the anti-inflammatories because of something called a two-hit phenomenon. It's probably that it was pre-existing and the coronavirus turned it on. So I would say it's probably okay to, well, I'm not going to give away the spoiler just yet. So we've established that there is an issue with coronavirus infections and cytokine storm. And I think this is exactly what happens that kills people. So there's something called hemophagocytic lymphohistiocytosis. And that's up here somewhere. Yeah, that's up there. So the idea with this concept, or HLH, it's for short, hemophagocytic lymphohistiocytosis, something like that. So I didn't know about that problem until I looked it up, but it is what happens with cytokine storm. So it actually is a disease process, and it's based, bottom line, it's based on the fact that if you have genetic predisposition, it's found more in kids, but if you have genetic predisposition and you have the right trigger, that's a two-hit, genetics and then the right trigger. It can be trigger of some of the parasites that are out there. Sometimes it's trauma, sometimes it's coronavirus, a couple of different viruses, and they've listed the viruses here has DNA and RNA, but coronavirus here, I think that was studied from the SARS epidemic in Taiwan. So coronavirus can initiate, if it's dormant, like a genetic predisposition, first hit. Coronavirus exposure hits and gives you two hit, and it produces cytokine storm, or the cytokine response. Again, the cytokine response is actually a normal response, but cytokine storm is when you can't stop this. Either, and I'll explain with the the datum that I'm going to present to you, and you hopefully will understand. So normally that cycle of events will stop once the pathogen is taken care of in the lung or in any part of the body, but in this case, the lung. I'm not sure what this was from. This is from influenza, but the same concept can be made for coronavirus, same pathology. You should be able to stop it, but it could be that there's a predisposition that you can't stop it, cannot stop it. So a version of hemophagocytic lymphohistiocytosis is macrophage activation syndrome. This happens in kids. So kids that are predisposed genetically to have this will usually have an excessive amount of something called IL-6. It's not here. IL-6 or interleukin-6. I can only think of explaining it in this way. When you have an inflammation, when you have the inflammatory cascade occur, like a cut in the arm, you'll have a bunch of things like this that are released into the system. I guess that would be these cytokines, and IL-6 and IL-18 are big ones that are called in to work as signals, not called in, but sent out to work as signals to attract more good guys to attack the bad guys. So in macrophage activation syndrome, the kids were found to have huge numbers of IL-6, and IL-6 predisposed to excessive calling out. So the increased amount of IL-6 in addition to an acute infection, again, two-hit phenomenon. This is just another study to explain that if you had an excessive amount of IL-6, the theory was pathophysiology that these guys came up. I don't know if you guys can see the whole study, but the pathophysiology was that if you had an excessive amount of IL-6, the IL-6 would down-regulate the natural killer cells. Hopefully I'm not getting too sciencey here, but bear with me. The IL-6 would down-regulate natural killer cells. Natural killer cells are T cells, and T cells are supposed to kill. That's what they call natural killer. And if the T cells that are coming out into the alveoli suddenly can't work, then the body's going to send more T cells because, or natural killer cells, because it's going to say, hey, We're sending out our army, but nothing's happening. So you'll just be flooded by natural killer cells, and and they might not work to kill the virus, but they will work to melt everything. So that's the problem is these cells, they try to attach to the virus and melt it and eat the virus. But if they're having a problem like IL-6 and macrophage activating syndrome, turning down the natural killer cells, if they have a problem, then the natural killer cells will start to accumulate and it'll fill in efforts to liquid. I think of the blob. These natural killer cells just come, they engulf, and they release enzymes. That's how I think of it. And the enzymes melt the virus. But unfortunately, if you release too many enzymes, think of it that way, then not only will you melt the virus, but you melt the tissue. And if you melt the tissue, the tissue is supposed to keep air in one side and fluid in the other side. But if you melt the tissue, you have extravasation and you'll be full of fluid. Remember, this can also leak into other places: brain, bowels, liver, spleen. Everything melts because because you can't stop the reaction. You'll have all your organs melt down. It's called multi-organ failure. It starts with the lungs, but because the lungs just are overcapacitated or filled with all the good guys, trying to kill all the viral particles, because there's a lot of viral particles, because their job, the viruses is to invade certain cells, multiply quickly, and explode and accumulate more viruses. So the body, in an effort to control the massively and quickly reproducing viruses from the zombie cells, it'll call in more natural killer cells, granulocytes, lymphocytes, and it'll try to keep up. But in actuality, all those cells, all the good guys that are trying to kill, they kill the organ, the lung, and they also kill the spleen, and they also kill the gut and the brain. See, that's what, the heart. So that's why you have multi-organ failure. In the case where I explained yesterday how ACE2 receptors are in the gut, the heart, and the lung mostly, they're also everywhere else, but those organs will die. And that's why if it's allowed to accelerate, this is the pathology of this thing. It accelerates damage, just like it accelerates its invasion. If you look over the course of time, logarithmic increase, well, it accelerates. If it's out of control, it accelerates damage to the virus, but unfortunately to the body. So this is the basic literature on cytokine storm, and it is an entity, but they call it cytokine release syndrome. Cytokine storm is more of a layman's term, but all the information thus far, I have not been able to find anything that says anti-inflammatories are the only reason for it. So I guess Micheline, I don't think I would take an anti-inflammatory either way. So I agree with you. I'd probably stick with Tylenol. And there's some people who say you shouldn't even do Tylenol because it dampens the fever, and the fever will kill. But hey, listen, between a fever killing virus and your army killing virus, I think if you feel better with Tylenol, I'd rather bring down the temperature a little bit so you'll eat and have less pain, and then worry about these guys. Well, these guys should do their job unless you're genetically predisposed. Now, you don't have to be genetically predisposed. You can actually have this thing ramp up. So I guess the question is, can you have cytokine storm or a cytokine release syndrome without genetics? And I'll have to leave that one. But again, I'm just reviewing all this stuff. But these in cytokine storm or cytokine release syndrome, you can see that many systems will be affected. Sorry, it's in black and white. I don't have a color printer. Can't afford one, but one of these days. And this is just what usually happens. So on this side, you can see the beginning, and then you see it essentially cycle out of control. And here you have mild, grade 1, until grade 4, where you have mechanical intubation and ventilation. So, and then a whole bunch of other things. So that's the way it progresses, grade 1 to grade 4. Now, I think what happens, my estimate is that what happens with people who succumb, especially older people, they can't tolerate this cycle of events, and the organs, and probably with older people, they have faulty beta cells, T cells. They have a faulty bunch of good guys that don't exactly work great, and maybe when they work great, they don't exactly know how to stop. That's my hypothesis. So I would still say avoid the NSAIDs. See the video down below for what an NSAID is. It's probably okay for Tylenol to make yourself comfortable, because I think if you're watching this, you're probably not going into a cytokine storm or cytokine release syndrome. But the worry about getting to this stage, most of us that are 65 and below without too many medical diseases, like my warriors, probably be fine. My patients who are in that range, 65 or above, if you're healthy, probably do fine. If we avoid contact, and if the stupid kids would not go into congregations on the beach, I don't know if that's real or not, but we all as a nation have to really isolate. And my daughter just came back from the Caymans, and I said 2 weeks. 2 weeks, you got to stay in the house, and I'm sure we'll go crazy, but get some board games, get some karaoke. No alcohol, because unfortunately that lowers the immune system. But hey, we'll deal with it, right? There is one thing in particular I found that was released. This is information that was released by a company called Cytosorb. So I don't know if I could trust it, but it was from Wuhan in January of this year. They were trying to use, the company is trying to use Cytosorb to, it's extracorporeal recirculation. It's kind of like being on bypass. You stick a hose into one area where you suck the blood out, and then you put it through a centrifuge, and you put it back in, and you clean the blood. Supposedly, these guys with cytokine storm were able to get rid of, most likely, all these cytokines. Now, the question is, with extracorporeal cytokine, an absorbent of some sort, I don't know. I didn't see enough information. It's a novel idea. But who knows? And when you have information that comes from a company, you always have to think that it's just out to sell its product. But pretty cool. We'll have to see if it ever comes to Italy. I didn't see anything in Italy, but so it's essentially taking the blood out and washing it and putting it back in and taking away all the cytokines. So that's one way to do it. Once it happens, then it's a problem, obviously, and you're kind of trying to put things back into the body, and if it's all leaky, probably not good. So this is why you can't wait till a cytokine storm occurs. Again, I don't think it's from an anti-inflammatory hit. I think it's from an inherent excessive amount of viral particle hit. So how do we beat the excessive viral particles multiplying? We stay out of contact. 6 feet. Washing hands, masking, I think is fair, and avoiding places like my office or the hospital or an x-ray place or elective surgery. You have to avoid those places. Congregating, even if your 20-year-old group is healthy, I don't mean 20-year-old group that meets all the time. Gotta stop touching my face. I mean 20-year-olds having time to go to the beach in an area where it's not endemic, and then probably hanging out and smearing it on each other, hanging out and giving it to, or servers giving it to them, and then coming back. So we're going to have even though they're in Florida, all these kids that are going for spring break are going to come right back, and probably 1 or 2, remember, this spreads, they are not factors like 2 to 3. So that means for every 1 index person, you'll have 3 people infected unknowingly. So you multiply those 3 by another 3, and those 9 by another 3. You can see the logarithmic spread. And when these kids that are idiots are coming back to mom's house because they got off a plane and they have to stay in seclusion for 2 weeks, they'll spread it to the adults, spread it to the grandpops, and then we got a problem. So, I mean, if those kids don't stop, if people don't stop congregating, it's going to be a police state. And I don't think you want to do that. I was in the Philippines when you saw military everywhere, kind of spooky, but we'll have to see. Bottom line is, if you're at home, try to stay healthy. Try not to go bat crazy. Get out when it's nice outside in your backyard. Get some sun. Take some deep breaths, and we'll get through this. But Micheline, really good. You made me read, and I like the information. But I just would say it's probably not from the anti-inflammatories. It's probably from an inherent disorder. So if you have any comments down below on what you might have read as far as cytokine storm, put them down below. Otherwise, subscribe to me, and I'll see you in the next video.